My client came for a consultation just over a week ago, and her original treatment plan was to have more filler in the lips. However, she hasn't been to me for lip filler before, and after a full consultation, my guidance were to dissolve the filler what's already in her lips, purely because her lips were quite lumpy, and you'll be able to see it on the video. So with that consultation, she agreed. We had a treatment plan for her to dissolve the lip filler and then bring her back just over 2 weeks after to have a refill. She was completely on board with that. When she came to see me today, we completed a consultation form. She filled in the consent form and gave me permission to take photos, videos and share with social media, and also for my complications course. Before the client arrived, I prepped the area with all the equipment that I will need. This includes my hyaluronidase and also my emergency kit. I am now going to patch test my client. Firstly, I get the hyaluronidase. I check that it's in date. I make a recording of the batch number, and then I find the white spot on the glass ampule and I break it. I put the glass into my sharps bin, and then I place my hyaluronidase back onto my tray. I then pick up my tool back, 5mm, find the red dot and break the ampule away. Put the glass then into my sharps box, and I repeat this with the second ampule. In total, that will be 10mm. I then pick up my 10mm syringe, my Luer lock, open the packet and place it back down onto the tray. Then I pick up my 21 gauge needle, the green needle, open it and then secure it onto my 10mm syringe. I then draw back the tool back into my 10mm syringe, making sure that the bevel is touching the glass. Once I've finished drawing the solution back into the 10mm syringe, I put the glass ampule into my sharps bin. I then pick up the other tool back, because we want 10mm. I draw up 2.5 and then I place the syringe down. I then pick up my insulin needle, 0.3, take the cap off, and then draw back 20 units, 0.2mm. This is for my patch test. Then I continue to draw the rest of the tool back into my 10mm syringe. I flick the syringe just to ensure that there are no air bubbles. Then with my hyaluronidase, as you can see, the hyaluronidase comes as a powder form. Now we need to dilute it. So with my 10mm syringe, I put 1mm into the ampule and then I draw it back. I then place the solution back into the ampule and then draw back again. I repeat this several times just to ensure that the hyaluronidase has been diluted. Here I'm taking a note of the batch number, the expiry date, and making a note of it on my client's consultation form. I did do this previous to starting the video. So now I'm making sure that there's no air bubbles in my hyaluronidase, and I have 10 ml to inject if I need to. Now we've mixed the hyaluronidase, I will move the saline into a different tray so that I don't get mixed up. And then I'm going to draw up 20 units of hyaluronidase, what has been diluted, into my insulin syringe. I take the cap off, I take the back out, and then I fill the syringe. It does give you an illusion that it's full, but there are plenty of air bubbles, so just be careful. I then take the lid off. I flick the syringe to ensure that there are no air bubbles. We get rid of them all, and then I'm left with 20 units. So I have 20 units saline, tallback, and 20 units hyaluronidase. And as you can see, I do not mix the two together. Before we dissolve any filler, we will do a patch test. So we wipe the area clean with an antiseptic wipe. Dry the area and then draw across. One side I place an S for saline, and the right side I place a H for hyaluronidase. I then draw a circle in the middle of each grid, and this is where I will be placing the solution. I am now injecting the saline into the centre of the circle, 20 units. And then the hyaluronidase again in the centre of the circle. The circle is there so that we can see if there are any allergic reactions. And if there are any allergic reactions, we can see if it goes outside of that circle. We then take pictures of the area to ensure if there are any allergic reactions, we can go back on the footage. We then wait 20 minutes whilst monitoring your client. If there are no reactions, then we can proceed. Using Emla numbing cream, we numb the lips. You can numb the lips whilst you're waiting for the patch test to reach 20 minutes. Whilst my client is waiting, I then open up a 5 ml syringe and disperse the hyaluronidase into the 5 ml. I then open my 30 gauge needle and place it onto the 5 ml syringe, ready to inject. Once the 20 minutes are over, I then check the client again and make sure that there are no allergic reactions. I'll wipe the numbing cream off. I take some before pictures. Making sure that we capture every angle. And then I gently feel around the lips. The reason why we're dissolving this client is purely because of the lumps that has been created from previous filler. You can see that some of the lumps there are really superficial filler. We are now going to inject the hyaluronidase into the lips. We don't measure how much we're putting in, we're doing it by eyesight. Each client is so different. My goal is to make sure that all the lumps are dispersed from the lip and the hyaluronic acid disintegrates. As you can see with the 30 gauge needle, I'm going all the way in, not too deep, but I need to ensure that we are capturing all of that hyaluronic acid. As you can see already, on the right hand side, my client has already started to swell. This is totally normal and one of the side effects from hyaluronidase. As I'm injecting, I'm massaging as well. You can see how big the lip has got purely from those few injections. And now we're going to do the top, dispersing all of that hyaluronic acid. Always make sure you've got a gauze in your hand to wipe away any excess blood or product. If you've got someone with a lot of migration above the lip border, then you inject above the lip, just like so. Can you see how much is swelling? This is totally normal. I'm constantly asking my client if she's okay, if she can breathe, if she's in any pain, or if she would like me to stop at any point. My client was happy to continue. As you can see, I'm now massaging the lips again. Always massage after injecting hyaluronidase. This is to ensure that the solution is completely spread. Give it a good old massage all around the areas. And if you feel at any point that you need to put more in, then continue. Once I've finished massaging, I then take some more pictures just to ensure that we've captured everything that we possibly can and to also record the whole process. Once we've completed the procedure, I then give my client the aftercare form, talk her through it. If there are any adverse effects, like 5 minutes, 10 minutes, an hour, 2 hours later, I've asked her to call me immediately. But other than that, she was all good to go.